Today we have rarest of the rare guest, Dr. Amol Thorat, a prosthodontist and top-tier implantologist breaking down the real future of implants in dentistry. A personality which is known for sincerity, perfection and excellence. If you are a dentist wondering how many implants it takes to be confident, or if implantology is even worth mastering, this one's for you. Myself, Dr. Prathmesh, and you're watching Loosely Prescribed. अभी इंस्टाग्राम पे बहुत सारे इम्प्लांट कोर्सेज के एड्स आते रह रहे हैं. कुछ 6 वीक प्रोग्राम है, कुछ 1 वीक प्रोग्राम है, कुछ मॉड्यूल वाइज है या फिर कुछ 1 ईयर के भी हैं. व्हाट डू यू थिंक व्हाट ड्यूरेशन इज sufficient or enough to learn implant?
Knowledge has no boundaries. As a doctor, as a healthcare professional, we have to keep learning throughout our life. I am learning implantology for the past 25 years.
Okay.
And I still read books, I still read articles, I still attend courses, I still attend conferences. So how much is enough is a very difficult question to answer. It's never enough.
Okay.
So you have to keep learning. And definitely those 2 days, 3 days, 6 days, 7 days implant courses, they are definitely not enough.
Okay.
You can't learn anything which can be practiced. I feel to start with a basic implantology course should be of few weeks or maybe months, 1 month, 2 months, 6 months course in modules or maybe residency program wherein the dentist stays with the implantologist for a month or 2 months. So gets to see multiple cases. And that's where your understanding improves. Going somewhere and attending 3-day, 5-day, 7-day course doesn't make any sense to me.
Right. According to me कि प्लेसमेंट सीख जाएंगे 7 दिनों में 8 दिनों में अगर करना भी है, बट द प्रोस्थेटिक वर्क टेक्स लॉट ऑफ गुड टाइम. तो जहाँ पे भी प्रोस्थेटिक वर्क ज़्यादा मिल रहा है वहाँ पे आई थिंक पीपल शुड अप्लाई. एज अ प्रोस्थोडोंटिस्ट, हाउ मच important it is to have a very good prosthetic on implant?
Of course, yes. I mean, see, in my practice, we have an assistant who is with us since 2010. This is her 15th year. She knows precisely the entire surgical procedure. When we conduct courses, she would tell a participant, doctor, ये implant थोड़ा सा और नीचे जाना चाहिए, या ये थोड़ा टेढ़ा जा रहा है. So it's not about being able to place implants. But when I give a prosthesis, they know screw retained and cement retained prosthesis. They don't know why. That why, the answer to that why is where your knowledge comes into picture. So it's not, as I said, only the surgical part. The long-term prognosis of your implant restoration depends on the prosthesis you give on it.
Okay.
Yeah.
So you mean to say कि implant का survival is very very proportional to the prosthetic we are giving?
100%.
Okay.
100%. Let me tell you, the irony is all poorly placed implants integrate. As long as the implant is in bone, it will integrate. But
Right.
is it restorable? And will it stay in function after restoration is the question. So that's why in the start I said that implantology is a prosthetic driven entity with a surgical component to it.
Okay. There are some courses जो मॉड्यूल वाइज है बट दे आर आउट ऑफ कंट्री, लाइक बड़े बड़े यूनिवर्सिटीज के अंडर लेते हैं टू हैव दैट सो कॉल्ड डिग्री. इज इट वर्थ इट?
You can't put a price tag on knowledge. I'll just give you an example that I've been doing sinus lift surgery since 2008, and 2018 I went to US at Dr. Michael Picos to attend a program, the 3-day sinus lift workshop, which cost me 3.5 lakh rupees.
Wow.
For a 3-day program. But then people asked me, is it worth? If I take 1 point from that course, which I am not implementing in my practice, I feel it is worth.
Okay.
Now also, every year I make a point to attend at least 1 international conference. It's expensive, but then you'll get to meet so many people, you get to learn so many things, the way they practice, that is definitely worth it.
Okay, so attending conference is worth it.
100%.
ओके. बहुत सारे लोगों का ये भी मानना है कि 10 इम्प्लांट डालोगे तो आ जाएगा एक्सपीरियंस. कोई 30 इम्प्लांट्स, कोई 100 इम्प्लांट, 60 इम्प्लांट्स. दे हैव मेड ऐसे कोर्सेज कि ये कोर्स में आप इतने इम्प्लांट्स डालोगे. इन योर ओपिनियन, हाउ मेनी इम्प्लांट्स मेक्स यू कॉन्फिडेंट?
You all do general dentistry. How many root canals make you confident? Or how many extractions make you confident of extraction?
It doesn't make
So
sense.
exactly the same way, how many implants make you confident of placing implants is a very difficult question to answer. The thing is, if you have a sound theoretical background, if you have sound knowledge, you can apply that knowledge in your practice, in your implant practice also. That's why I said, when you asked me, when should you go for learning implants? So I said, spend some time in general dentistry first, because your basics then start becoming clear. You start learning your clinical science after passing out from the college. College में theory पढ़ाया जाता है. I have been into academics for 14 years. So college के बाद, college छोड़ने के बाद, you start actually learning what dentistry is and applying what you have learned in the college.
अच्छा.
Have sound background, have a sound base, and then you can apply that sound background in every situation.
Right.
अभी भी 20 साल के बाद जब मैं टफ केस करता हूँ, सो आई कैन फील द ड्रॉप ऑफ स्वेट डाउन माई स्पाइन.
Okay.
अभी भी स्ट्रेस आता है आफ्टर 20 years into implantology. So you can't say that I'm confident of doing everything.
Right. And it will, जितना expertise आएगा उतना अच्छा treatment होगा. There are many dentists who are giving implants for 25,000.
हाँ.
और there are many dentists जो are like मैं सब कुछ अच्छा करता हूँ लेकिन मैं 45-50 लेता हूँ. क्या है इतना ज़्यादा difference?
I know few dentists who do implants for 15,000 also.
हाँ.
So similar way, you have people doing root canals for 1,500 and 5,000 and 20,000 also.
Right.
So it's that ways. So not that ज़्यादा पैसे दिया तो बहुत अच्छा ट्रीटमेंट होगा या सस्ते में होगा तो बहुत सस्ता खराब होगा. It's depends. I mean, see, implants, we have got different companies. We have Indian made implants who are a copy. Then we have Israeli, Korean, and so many other implants. Each implant will have their own cost. Each
जी.
person will have their own overheads. वो डेंटिस्ट को जो कॉस्ट में कर सकता है, what he can afford, quoting it to the patient. So we can't say कि 25,000 वाला इम्प्लांट अच्छा नहीं है और 40,000 वाला अच्छा है.
जी.
So it depends upon which implant you are using. As long as, see, अगर आप सिर्फ point A to point B जाना चाहते हो तो आपको कोई भी गाड़ी चलेगी. But आप comfortably जाना चाहते हो, so you will like to buy a luxury car. So it's simple as that.
Any interesting case experience do you have?
Many experiences. There was one patient, he had undergone implant treatment somewhere else. Somehow it went wrong or it was not the way it should be.
Okay.
And patient went to his children in US. Over there the bridge broke.
Achha.
And he went to a dentist over there who said repairing it would cost you a bomb over here. You better go back to India. For the next 3 months that guy was having only soups and milkshakes. He was not able to eat. Then he came back he was referred to me by someone. We had to repeat the case, remove few of the implants and redo everything. And we loaded immediately, of course. And within a week, I gave him the teeth. A man actually started crying. Usne actually mere pair chue. So I was also little touched by this gesture. And there were so many such cases where I consider myself very fortunate that to be in this profession, that you get a chance to make a difference in people's lives. I think that's the greatest gift that God has given to me as a doctor.
I have personally seen your cases and the way you manage it aesthetically, जो भी है कि बहुत सारे एस्पेक्ट बस डेंटिस्ट को पता होंगे, पेशेंट को शायद पता नहीं चलेंगे. बट आपने मुझे बताया था एक बार कि एज अ डेंटिस्ट यू शुड बी satisfied when you are doing the work. I think doing it from someone who is like very seasoned is very very important if you are like too much oriented to the aesthetics and all. As an implant practitioner, how satisfied are you with the specialization in prosthodontics?
Thoroughly satisfied. When I joined prosthetic dentistry, I'm talking about 25 years back, prosthetic dentistry was limited to complete denture, removable partial dentures, and fixed partial dentures. That's it. And that every general dentist was doing. So a day before my counseling, I asked one of my seniors that I am getting endo. Okay? If I go out of Mumbai, I'll get oral surgery. And I'm getting prosthetics also in GDC Mumbai, GDC Aurangabad, and Nair. So what should I take? And he said, option kya hai tere paas? You have to take Prostho.
Okay.
And he was appearing Prostho, MDS Prostho at that time. And I said, yaar, but Prostho ke liye kuch scope hai kya?
हाँ.
So that time, 25 years back, he said, देख अमोल, scope किसी का नहीं होता है, scope बनाना पड़ता है.
अच्छा.
Being a 22, 23, 24-year-old guy, मेरे सर के ऊपर से गया वो. But I said, okay, next day I took GDC Prostho. And here I am.
Okay. If there is one chance कि आप वापस 23-24 के एज में चले जाओ, again you have that same decision to make, but with the knowledge कि प्रोस्टो में क्या है, oral surgery में क्या है, पेरियो में क्या है, और other branches में सब में क्या है, what branch would you choose genuinely?
I would again choose Prostho.
Okay.
Today also, I left Nair Endo, but I never regretted it.
अच्छा.
By the time I resigned from Sassoon Hospital, I was doing almost more than 100 extractions per day and almost one surgery every day. If I do oral surgery now, I will be again limited to impactions and episectomies and maybe few fractures here and there, which I do now also. At one point in my career, I was doing about 35 to 40 minor surgeries in consultations.
Okay.
So I have that surgical exposure. I'm not interested in endo. Ortho also I'm not much interested. So I would again choose Prostho. Because Prostho is a branch which is like a multidisciplinary branch. You have to think about the periodontal aspect, you have to think about the surgical aspect. And of course, when all other branches fail, it's the prosthetic dentistry that comes to the rescue of the patient.
Okay. Sir, there is a lot of digitalization that is happening in every field of dentistry. What have you seen related to implantology? Like something that makes it amazing?
No, it's a boon. Having digital dentistry, having latest technologies is a boon to us. Few
Okay.
things which we sometimes will have to just imagine, or which we just do on the basis of our knowledge and experience arbitrarily. Now, with the advent of this artificial intelligence and digitalization in implantology, we can consistently do them in a better way. Okay, more accurately. But having said that, let me add one thing, that in an attempt to go digital, you can't sacrifice your surgical skills, your dexterity.
Okay.
So you can't say, I will do only digital dentistry. No. If something goes wrong, you should have those skills to fall back to conventional protocol. Otherwise, you are in a fix. Like in implantology, I would say I do always guided surgery. But if that guide does not fit, for whatever reasons, I should be in a position to remove the guide and place it aside and do a freehand surgery.
Okay.
So you can't compromise on your surgical skills in an attempt to go digital.
Acha. I want to ask you a very personal question. Right now, there is one very hot topic that is going, which is little controversial amongst dentists. How much do you support all-on-4 concept?
All-on-4 concept is not new. It's been there for more than 20 years. Paulo Malo and Bo Rangert published their article way back in 2003 with a success rate of more than 95%.
Acha.
So it's not new, but they have a rigid criteria. Not each and every case fits for all-on-4 protocol. Now, this is something very poorly understood. What they said was, you have to place longer implants, you have to go for bicortical anchorage, you have to have sufficient width of your implant, and you have to have good AP spread and rigidly splint all those implants. So if these criteria are met with, you can go ahead with all-on-4. But again, not in all the cases. If the patient is a bruxer, in India we have this habit of gutka and supari chewing. वो patient जिंदगी भर सुपारी खा रहा है, उसका masseter कितना strong है. You do all-on-4 and patient comes with a fractured implant. I treat so many such failed all-on-4 cases. So there is a very nice saying as it's all-on-4 or all-on-floor.
Okay.
So yes, all-on-4 does have their own indications, but you can't fit it in all the cases. So as I said, your plan has to be patient-centered. You have to check what is present in the opposite dentition. You have to check for the density of the bone, the patient's eating habits, and so on. And if indicated, if everything goes well, if everything is ideal, then all-on-4 is a good protocol. Otherwise, I personally prefer little over-engineering, placing 1 or 2 implants more than what is minimum required. All-on-4 is minimum in any case. Okay. But why to go for minimum? There is no good reason. I don't find any good reason to go for minimum number of implants. I would rather place 1 or 2 implants more and have a peaceful sleep at night. That is for me my priority.
Okay. For a dental student who is in right now, maybe first year, second year or third year, what is that one tip for them to make a good dentist in future?
Do what is required from you to be done at that stage. As of now, you are a student. So your job is to study. So padhai karo. Do it sincerely, things will fall in place.
You have been in academics too, right? Like how much time you were in academics?
14 years.
I know you. I have heard about you that you are like very strict when it comes to knowledge. But it is something very, very important that I've realized now. What is the one mistake that you have done when you were doing BDS that people can avoid now?
We used to stay in hostel. What is right, what is wrong, there was nobody to tell us. We were not having any mobile phones. So we used to contact our parents maybe once a month or so. तो क्या सही क्या गलत यही मालूम नहीं था, right? So student life में पढ़ना होता है, ये बताने के लिए हमको कोई नहीं था. So we used to just kill our times. Prelim आ गई, कुछ लोग फेल होते थे, कुछ जस्ट पास होते थे. फिर not that we lacked IQ, but जो seriousness था पढ़ाई के लिए वो थोड़ा कम था. And then between prelims and final exams, we used to stretch for 18-20 hours a day, cover the syllabus and get good marks. But I feel as a student, if I would have studied throughout the year, it would have been better. इतना stretch करने की जरूरत नहीं, and my concepts would have been better rather than रट्टा मारो and exam में लिख दो.
Okay. I think we have covered almost everything that one should need or require to understand if they should do implantology, how it is going to be and everything. Thank you so much, sir, for giving your output. It has been very incredible and very informative podcast. I hope the people will like it.
Thank you very much. It has been my pleasure that you invited me over here. All the best to all those young enthusiastic people who want to venture in the field of implantology. And I would recommend them to keep studying, because you have been blessed to become doctors and treat the patients. Not everybody gets that opportunity to, and make full use of this. Thank you.
Thank you, sir.